Welcome to the FEMA Region 10 Mitigation Planning Coffee Break Series, and today's topic, Addressing Social Equity Through Natural Hazards Mitigation Planning. Your panelists today are Brett Holt with FEMA Region 10, Himanshu Grover with the University of Washington, and Jana Pepeef with the City of Portland's Bureau of Emergency Management. Brett, take it away.
Thank you very much, Becca. I'm very excited about having this particular coffee break. It's one that it's been discussed, I know, within region and in our various programs. We've talked about it in post-disaster recovery. How do we have an equitable process in how we're approaching mitigation, in how we're doing post-disaster recovery? How to ensure that all groups within the community, the populations, are being addressed in a fair manner. It's a challenge. It's not always easy. A lot of things play into this, but I'm happy today that we have two speakers, Jana Pepeef from the City of Portland, and then Himanshu Grover from University of Washington. Jana is the Planning Community Resilience Manager. She is responsible for mitigation, response, and recovery planning, and for community outreach programs related to preparedness and resilience, and she is AICP. Himanshu Grover, also AICP, is the co-director of the Institute for Hazard Mitigation and Planning from the University of Washington. His focus is the intersection of land use planning, community resilience, and climate change. So we have some outstanding speakers here. But to kind of kick us off here, let me just do a couple of slides on our what we're going to be talking about. Hopefully you're going to look at what are some of those opportunities to address social equity through mitigation planning process. What are these categories of at-risk people? What are we talking about with vulnerable populations? What are some of the challenges to ensuring an equitable planning process? And what are some tools that can be used to address social equity? So hopefully you'll be able to get some of that from our presentation today. As Becca mentioned earlier, we will have the PowerPoint itself will be made available afterwards, as well as we have some additional materials and tools that you guys can use, and examples from a few of our jurisdictions. So mitigation, what is it? What are we talking about here when we talk about this mitigation planning process? What are we trying to mitigate? Mitigation is the reduction or elimination of long-term risk to human life and property from hazards. It's something that we're trying to do in the steady state. It's the most ideal time, but of course, right as we're doing recovery, you're taking advantage of that. But it's through this opportunity that we're making these decisions as a community to mitigate that we want to be able to talk about ensuring a holistic approach, addressing, making sure that we have not just consideration for our various populations in our community, but also ensuring that they have input into how where homes are going to go, or how we remove homes or buildings, in terms of how we make decisions on our community outreach, or how we do address people, making sure that we educate, of course, on impacts, because a lot of what we do through mitigation planning can inform our preparedness efforts and our response efforts. So why do we address social equity? Well, it is, the most vulnerable are likely to be hardest hit during disaster. Those are the ones that might take the longest. Perhaps they have insured homes, or perhaps they have the longest to recover in terms of they don't have the savings built up, or they may not have the family connections that can help them out. Perhaps it's just even the locations or the areas that have been built aren't always the most desirable ones, and the ones that we sometimes take longest to make decisions to rebuild in. So these are the areas, so we want to make sure we're reaching out to the populations. But we do it because it provides a fair and balanced approach to helping all of our community members as it relates to both our pre-disaster and our post-disaster. And I understand fair and balanced might be something that each community will look at what does that look like to be fair and balanced. But I'm going to use that term generally here. We want to have a clear understanding, of course, of how and where at-risk groups might be most affected during a disaster, because it will help you allocate resources efficiently during an emergency, before or after. And so going through, not of course understanding the demographics, but also reaching out and talking and seeing where these particular groups are at becomes an important part. And then of course policy is being developed and projects are being implemented that could have a direct impact on these at-risk populations. And so it's one thing to go in and do it without having their input, but it's another to really have them be part of that solution. So is there a specific FEMA plan and requirement around this? No, there's not one that you look in our planning guidance that says there must be a social, an equitable process that then addresses everyone. We have our particular requirements a little bit higher, and it does leave it up to the community. What we're really doing here is trying to encourage that best practice, trying to encourage one that does create a more, not just a holistic planning process, but one that encourages a much better plan in the end. It does vary by community what this looks like, and it is challenging. And so today's topic is not really about requirements per se. It's about, in a way, doing the right thing. But we have opportunities where within these requirements. So we talk about, in plans, you do community profiling, and we ask, so within that, there's an opportunity, of course, to say, what does our community look like by all the various populations? In our risk assessment, and looking at where the overlay of our hazards are with populations, are you able to get to that kind of detail to know where perhaps those populations are at, or the low-income populations, or do you know where the various age groups are at? In your strategy development and prioritization, there's also another opportunity there to look at what are the impacts of your strategies, and then of course the community engagement itself. It's one thing if you're saying, as we see in plans, that we put it on a website and people could comment. Well, not everyone has access to a computer, and maybe not everyone's available on those email lists. So how do we actually reach out to these particular populations and say, I don't want to just push information, but I want to receive information from you. So with that, I've noticed Himanshu just joined us.
Can you hear me? Hello.
We can. Thank you. I'm glad you made it.
Excellent. Hello, everyone. I really can't see who all are there, but hopefully there are quite a few. I think I'm sure you've had an initial spiel from Brett as to what this is about. And the way we're going to do this is I'm going to kind of take you through a little bit the concept and the overview, or a larger framework, that how we look at social equity through, especially in terms of hazardous mitigation planning, and how to kind of incorporate these considerations during the plan making process itself. Frankly, it's a lot of it is thanks to the city, to Portland, and thanks to Jonah, who's going to speak next. They gave us this opportunity to actually test it out in the field as part of the hazard mitigation planning project. So a lot of the things that you'll hear about are the things that we tested out, that we worked with during the plan making process on Portland. And so I think she, following up with her experiences and her perspective on this, would provide a good bookend towards this side to kind of say, oh, this is what he talked about, and this is what we did, and this is how it happened. So I think it'll provide you with good insights into how we can do this. All right, next slide. Okay, so just the key terms. I'm not going to go through them, but this is, I'm a professor, so I get to do that all the time. Try to start with, all right, this is my dictionary. This is how I define each term. And I think all of us kind of agree on how hazard triggers disaster risk and how we look at risk reduction. The key thing I do want to highlight among these is that often when we talk about risk reduction, we tend to ignore the population aspect, or sometimes when we really do use it too, we take population as a whole, as if all groups are equal. And I think over our experiences with all these recent disasters, starting with Hurricane Katrina, which actually highlighted it a lot for the present generation, though most of the researchers knew it all along, is that not all population groups are the same. There are specific groups within a community that are likely to be impacted worse by the same event, and which has nothing to do with the intensity of the event, but it is a lot to do with the susceptibility or the vulnerability of that group. And what happens is if we don't pay attention to these groups at the onset, during our planning stage, then in the terms of response and recovery, we have to spend at least 10 to 15 times more to cater to these populations because these are the ones who are impacted the worst. Next, please. So, but what is equity? This is one of the typical ones. Of course, I didn't make it. I downloaded it from somewhere. But this really provides a good idea about what equity looks like. So if you see what happens is in terms of reality, which is on the right-hand side, shows that everybody is kind of at a different stage. Every group, every community is at a very different, has different access to resources. So this example would be people trying to watch a game over the fence. Not everybody is of the same height. Some have a better view, some don't even have a view. The first figure shows equality, which is what we usually start with. Yes, we should provide everybody access, everybody can see it, but that does not really help because providing the same access and the same resources to people who actually have differential access already just heightens those differences. It does not really help to make them equal. So the middle slide is what we strive for towards equity, is trying to provide resources which are geared towards achieving an outcome. So here the target, the goal is to allow everybody to be able to watch the game. And so we provide resources appropriate to each person's height so that the outcome is equal for everyone. So the difference being equity is towards getting equal outcomes, rather equality is providing equal resources. And so I think this picture, this set of pictures highlights what we're really talking about. So providing more resources to a certain group is not really favoring them, but it is basically trying to get them at a level playing field with everybody else who may or may not need resources at all. Next slide, please. So the way I kind of used to describe it, to describe the role of looking at vulnerable populations is, could we just get the whole image right away? Yeah. Look, something happens. Oh, I think the fonts went away. But basically, disaster risk would be is a combination of the hazard and the vulnerability, like I said. So the unsafe conditions, which basically are the vulnerability that, when overlaid with an actual event, tend to result in the risk, are caused by a number of things. Two most important being the root causes, which is basically access to power, access to resources. Power hereby mean ability to access resources, ability to talk to people, ability to talk to the local government, to be able to put their point forward, to be able to participate in the local processes. And of course, dynamic pressures, which include lack of information, training, and trust. And these two things are not something that are created by a disaster. Rather, they are just magnified or amplified by a disaster, by a hazard event, which results in increased poor disaster outcomes for these communities. So if you look at it in this way, that conceptually, we can't really do much about controlling most of the hazard events. All we can do is control this unsafe conditions, this part of the dimension. And a lot of these unsafe conditions, for example, even the house you live in the quality of the house, the kind of the structure, the place where the house is situated, are predominantly an outcome of these underlying root causes that interplay in different community groups at different stages, depending on cultural, historical, and other reasons. So as part of our vulnerability or risk reduction, it makes sense then to target these areas so that we can reduce the unsafe conditions and thereby decrease or reduce the risk from any hazard event in the community as a whole. Next, please. So it's really interesting that if you think of it this way in the medical terms, that that the vulnerability or the susceptibility, how weak your immune system is, basically determines how sick you get. So if you are immune, you will not get sick. But if your immune system is weak, then you are prone to getting sick. And I think as part of the hazard mitigation planning, our focus is trying to build up the immune system, trying to build up the resilience and the resistance within the system so that it doesn't get sick, which is what the key component of it is, looking at equity, because that can actually help a community enhance their immune system so that they don't get sick too much in case of a hazard event. Next, please. So one of the key things again is that I usually highlight is that we often tend to have the focus increases on a specific disaster event, but if you look at the disaster outcomes, they're not truly caused only by the event, but rather it is a cumulative outcome of systemic issues, which I highlighted earlier, the root causes and the dynamic pressures that result in unsafe environments for the people. And basically, it's our action, or more often than not, lack of action preceding to the disaster event by not paying attention to things like equity, or by still developing into high hazard areas, not taking care or not understanding or even appreciating or recognizing the exposure of most vulnerable groups, which results in increased losses post-disaster. So the key is we need to try to at least identify these groups and make sure we can provide them access, but try to eliminate the root causes and to try to release the dynamic pressures that result in unsafe conditions for various sections of the society. Next, please. And even though FEMA does not really have a specific, I would say, a requirement to do community looking at these vulnerable sections and actually doing a lot in terms of social equity through the planning process, but I think it is part of the overall definition itself, because hazard mitigation is all about reducing your risks, reducing negative impacts of disasters. And so from societal perspective, equity is critical for effective hazard mitigation. So it doesn't need a separate flag. It's just that we need to understand that hazard mitigation also includes this. It's just not, we've come to realize it's just not structural measures. There are all other things going to it. And social equity, attention to equity, looking at vulnerable population is an important and integral part of hazard mitigation within the existing definition of hazard mitigation in FEMA itself. Next, please. So the idea is that when all these things kind of, the unsafe conditions, root causes, and dynamic pressures, they kind of contribute to the vulnerability, we try to do as much as we can to reduce this vulnerability so that, we don't have poor disaster, we don't have increased negative outcomes of disasters. Could we go next, please? This should be yeah, here it is. So, and an example that I often give is, like I said, that disasters don't create these conditions. They tend to magnify these conditions, and the magnification, you start to take notice. And that is an example, a watershed movement in hazard mitigation planning and, disaster management was Katrina, where we saw that, non-whites were disproportionately affected by the storm. A lot of the individual household level impacts were results of how the race, income, and class issues intersect and operate in our society. We saw that the minorities were the ones which were located in poor quality housing. They were segregated into low value neighborhoods which did not have access to resources, which made them extremely vulnerable to the hazard event, and thereby that the losses that they suffered were significantly higher than the rest of the community. Let's go to the next slide. It kind of shows some of the data. So this is a sample of the data that we got from there, that the African Americans accounted for 44% of the storm victims, and then 1/5 of those displaced with the storm were likely to have been poor, and 30% had incomes that were below 1.5 times the poverty level. Now, the thing is, this shows that all these people were staying in these vulnerable areas, and this is not just by chance or because they chose to be there. It's because the way the system is, the way the development processes and the pressures work, they had no other option but to be there. Most of them had to be there because they couldn't go anywhere. They couldn't afford to live anywhere else. So these are the things, if had been known beforehand, that, the people who don't have the resources, who are the worst off, are living in these areas, then a targeted mitigation measure would be to provide them resources to increase the the housing quality in those areas, because we know that if they're poor, if they don't have the resources, if they're in at-risk areas, their housing quality is not gonna be that up to the standard, which is gonna be much worse affected by any kind of a storm. Next. So why consider equity in hazard mitigation? Because by considering equity in hazard mitigation, we can have a lot of impact. We can actually reduce vulnerability to a great extent. We've been looking at hazard mitigation for so many decades already. We've looked at structural measures, we've looked at non-structural measures, we've been looking at creating dams, dikes, we've been looking at creating land use decisions, but social aspect has somewhat not been addressed to that extent. And we can see the outcomes that the disaster losses keep climbing, even though we've learned so much from all these disasters, we still can't get a handle on trying to reduce the impact, reduce the societal impact. So if we are focusing on reducing the societal impacts, we actually need to look at the society. So it is important to consider equity because it can help minimize the impacts of disasters. And not only that, it actually provides a better quality of life in the absence of a hazard threat also. It helps to build a lot of trust and networks which can actually be relied upon when for not only if you have to pass on the information to evacuate and all, but also in order to build a better and a more equitable society. It will enhance how the quality of life in the community. People will rely on each other. They have a high degree of level of confidence with the local government. Next, please. So some of the key concerns that, like I said, we get some from the literature, but then we added on to it based on our experience in Portland include that we really do need to recognize each social group's degree of vulnerability to the same hazard event. Often what happens is as part of our planning process, we do these public meetings, we get people onto the same table, we create these working groups, and we tend to come up with, we need to come with a consensus on a lot of things. Here, we kind of experienced was that each group has its own unique conditions, which may not necessarily just remain related to hazard, but they are related to a lot of other things that are happening. So the mere fact that we're able to identify and recognize those goes a long way in building trust and being able to identify the right policies. We need to look at how, when we create these stakeholder workshops and get people to get on board, what is the ability that they can participate in the process, and we need to recognize that. We need to provide, like I said, in equity, we may have to do extra efforts to provide more detailed resources, more information to certain groups because they have never had access to that information. They never knew that kind of information existed. Or, for example, provided in the language that they need. We found that a lot of immigrants often who participate in this planning process do not carry on with the process. They get frustrated because sometimes the language, the words, the terms that are used are some things that they never heard of. So it makes sense to recognize what the community is and try to communicate directly to those groups, even if it means that certain groups need more of hand-holding, need more of resources. And of course, trust plays a major part in all this because unless they trust you, it doesn't really, you can't go anywhere. You really need to build the trust. And the first step in building trust is recognizing that they need more help, being able to provide them with those extra resources so they feel that the lack of the resources is being addressed. It doesn't mean you're doing everything that they need. It's just that at least you're showing that effort and you're putting in things that can help them be a more effective and a useful part of this planning process. Next, please. So what things that we look for, some questions that we ask at the starting of our workshops, especially with hazard mitigation planning, is look at participation, look at whom do you want, what all. Often it is said, give out a public notice, engage people and get them to come. But the key thing is not everybody gets that notice. Not everybody goes to the same, community event that you post these flyers on. So when you start doing the hazard mitigation planning process, you have to take that extra effort to go out and reach out to people that exist in your community, but maybe have not yet been involved in the process, who do not have that ability to participate, which means you may have to do a lot many stakeholder workshops, may have to do stakeholder specific workshops. So the who, when, and the where is really important. You you need to go reach out, find these people there. When you have to find a time which is useful, which works for them. Not the same time works for everybody. You can't have a workshop every time at 6 o'clock. One of the things I really liked about the workshops that was done in Portland was whenever they were done on a weekend or I think even in the evening, they always had food because they were really they wanted to make sure that the people who came in did not have to worry to go back, and have meals. They always allowed all the stakeholder partners to take food back home for their family. So I think that was actually a very good thing that happened as part of the planning process in Portland. Reaching a common framework or a framing. They all have conflicting issues that need to be recognized. It will always be a challenge because people will not agree on everything. I mean, if they would, we wouldn't have any problems. But that is something you have to work with. You have to see, where you reach. And related to it is often what will happen is when you get people who have actually been ignored for so long, who feel they have not had a say in the planning process, tend to talk about so many things which may not directly relate to what the stakeholder meeting is for. So what we worked out in these kind of meetings, we create what's directly there, and we create a second sheet of concerns to be addressed at other forums. So we would create that so that the people don't feel that they are being ignored, but rather identify, for example, if somebody had a concern related to, let's say, uh, any kind of new development coming in the community, they would be connected to the appropriate authorities, appropriate person in the local administration where they could voice those concerns. So when in the stakeholder meeting, even though the question is looking at hazard mitigation, you would be able to address these things, not discuss them, but tell them, oh yeah, that's important. We're not going to ignore it, even though it is not part of this process. Here is somebody who's going to come to you and talk to you about it. So that helps. Uh, and part of it again is recognizing these hidden and underlying agendas, because there might be some people, or often there are a few people who just like to be disruptive in those meetings, and not for any wrong reasons. It's just that they are frustrated with the process. So it's important to recognize these things at earlier in the process. And the part of the equity is to kind of reach out to them outside, provide that extra hand holding to be address those issues which may be beyond the stakeholder workshop that we are having, in order to ensure that subsequently those workshops kind of work better. And of course, continued feedback engagement we found does really help a lot. And this is not even within just the participation calendar, but rather think of it as an ongoing process. I mean, one of the things that we have now been kind of focusing on and telling people is not to think of public participation as a part of hazard mitigation plan making, or as part of public participation as part of comprehensive plan making, but to instead reverse the thing, make public participation as the main theme, and then do hazard mitigation planning as part of the larger public participation process, do comprehensive planning as part of the larger public engagement process, do all those other plans that we make and as part of the larger umbrella of public participation. And the idea being, and the focus here is that it is important to partner with the public in any kind of development activity, and so that should be an ongoing process, and the planning task should feed into the larger process. Next, please. So some of the things that you should think about is the key things to do is look at a comprehensive vulnerability analysis, identify the groups which are vulnerable. There's significant literature out there which kind of talks about, what kind of people are more vulnerable. And remember, this is one more thing I always highlight, that, often we have these traditional notions that these people are more vulnerable, but that's not true at all. And it all depends on the context of the community. For example, we always consider, non-whites, non-citizens as being more vulnerable, but we have found through examples that, Latinos are pretty much very highly resilient in most of the Gulf Coast communities because of the intense social networks they have. So Just taking the standards doesn't help. We need to know our community in a better way to identify who's vulnerable. We need to know why. Why are they vulnerable? Is it because they're poor? Is it because of the racial inequality? Or is it about something else, some kind of other access that do not have that access to resources? And of course, in terms of risk analysis, it's important to know where they are situated, because that helps us to determine the risk exposure. At the same time, we also need to understand there are a number of vulnerabilities that may not be spatially explicit. It might be more cultural. But one of the examples I often like to give is that certain immigrant communities don't really relate well to a white man coming in and giving them lecture how to reduce the vulnerability. They are more open to receiving that information because of that trust factor from somebody from their own community. So we need to recognize these concerns as part of the risk analysis process in the hazard mitigation planning. Next, please. So some of the vulnerable groups that we know exist and we need to identify at the onset itself include isolated, marginalized, or socially or culturally groups. These could be physically or they could be culturally isolated. Immigrants, especially illegal immigrants in the present state of affairs that we have, low education, illiterate, low income, non-English speaking, homeless, small children, single parent households, elderly, and those with physical and mental disabilities. Again, this is a tentative list. This is not the full thing, full scope of things, but these are some of those things that can be a starting point when you want to identify vulnerable groups in your community. It's part of the social vulnerability analysis that we would do through the hazard mitigation planning process. Next, please. So the idea is, part of the thing was that when all these things exist, we basically need to have some kind of a way of highlighting these issues and these concerns in the policy formulation process of hazard mitigation planning. So we kind of call this as the equity lens, and I think Jonna would talk more about how they've implemented this in the portal planning process. So the things that we look at again is the spatial distribution, the specific impact on each group, what kind of support the groups need, and also looking at long-term activities of trust building, communication channels, engaging in partnerships. So these are non-spatial risk reduction activities that we need to look at. So this is like preparing a long-term plan to engage with the people. Next, please. Brett, how am I doing on time? Do I need to wrap up pretty quickly?
Yeah, I'll just say yeah, because I know Jonna definitely has to. She's got a hard stop here for her presentation.
All right.
So,
I know. Yeah. So I think we have only 2 or 3 more slides. So I'll just go quickly a little bit. But some of the things that we have recommended as part of your using an equity lens in hazard mitigation planning is to look at how do the proposed actions reduce or make worse the historical disparities. So key point is you recognize these exist and you see how your planning process and the planning proposals and the outcomes increase or impact those. We need to look at who all benefit. Is it just the people who are at the table, or is it everybody? Or at least the people who are most vulnerable should get the greater benefit. What are the direct and unintended consequences? Because that's kind of key. Often, we believe nobody wants to do anybody harm, but the problem is getting people to understand that there can be unintended secondary consequences that also need to be addressed is a challenge, but we need to recognize that. And look at proposed actions, how do they contribute towards long-term capacity building and trust building. Next, please. One of the key things I really do highlight as part of the hazard mitigation process and engaging with people through in these public forums is to recognize and respect importance of beliefs and custom. A lot of people, each section, especially the ones which are marginalized, tend to have more stronger beliefs and customs, which we need to really address, or we need to at least recognize so that we can provide resources for that. We need to consider how these people from these family-centered cultures will respond to a disaster. We can't have them that even if you're all working, you'll have their own separate emergency plans and then you meet at a place and go. No, certain families will not go without each other. So you need to recognize that and not say, oh no, that's not a practical way of planning for it. Key thing to address is in many communities is to look at how the language issues would be bridged because not everybody has access, or rather can understand, the same English printed announcements and manuals. They need to be translated into the local languages. I think we're on the last slide. Next one, please. So what we know, those are the concerns. What we know works is identify the vulnerable populations from the onset, increase tracking of vulnerable population. Doesn't mean putting a GPS on everyone, but all it means is going back to the public more often and knowing where people are moving, create trusted modes of communication. As I said, create a larger system of community engagement and feed in your planning processes through that. Have effective communication between agencies and people so they know that these are the community members we need to reach out to. Practice. Have more exercises, more drills, get people to be engaged more. And of course, overall, prepare this atmosphere of trust and openness, because what that does is it allows people to feel that we are being cared for, that their needs are being addressed. I think that wraps the spread. So hopefully I have left sufficient time for Jonna to go through her section.
I think we're great. Well, thank you very much, Himanshu. I'm glad you're able to join us. I'm going to now turn it over to Jonna, and please introduce yourself and take it away.
Thank you. Good morning. My name is Jonna Papescu. I work for the City of Portland Bureau of Emergency Management. We had the pleasure of working with Dr. Grover when we updated our natural hazard mitigation plan, which was completed last year. And I'm going to talk to you about how we use some of the concepts that Dr. Grover described, maybe in a more academic context, and how we applied them to our local jurisdiction. Can you advance the slide? So I'll start by specifically describing the actions that we undertook to incorporate equity into our mitigation, what we call the mitigation action plan update, and then sort of what we learned from that in terms of how we would like to move equity forward in our organization, given our experience with the map. Next slide, please. Thanks. So starting with the actions that we undertook as part of the mitigation action plan, this was our first kickoff flyer that you see on the screen there. Next slide, please. So we started out with a commitment to incorporating equity and equitable engagement in the plan process at the very beginning. When we scoped the project, and so when we were grateful to receive a grant from FEMA to partly fund our hazard mitigation plan update. And when we submitted that application, we highlighted the equity focus quite a bit. And candidly, I was so gratified when Brett called and asked me to participate in this presentation, because initially when we turned in our first grant draft application to the state, the feedback that we received was that it was great that we were interested in equity, but that we didn't need to include it in the grant application because it wasn't one of the things that FEMA would be scoring us on. But we pushed back a little bit and said, well, we want to be accountable to our commitment to equity, and so we are choosing to include it in the grant application, even though that's not required that we describe our work there, but we included it there. And then moving forward, we did, in terms of our plan update, we used some of the money to hire a limited term position to be sort of our inside person to help us particularly support community engagement, but then we also contracted a lot of the actual writing of the plan to a firm that does a lot of natural hazard mitigation plans. And when we wrote their scope of work, we included some deliverables related to equity and actually required them to bring on board someone who would just be focused on equity, so they had to subcontract that. We also, when we convened our steering committee, that we described the purpose of the plan is to mitigate hazards in an equitable way, and the charge statement that we gave to the committee highlighted that. So overall, I would say that it was important to us at the beginning when we were still feeling energized and hopeful about the project, and we were making commitments that we did in all the documents about our project, talk about our commitment to equity and create opportunities for others to hold us accountable to that. Next slide, please. We had one steering committee that worked with us for over a year as we developed the plan. We initially had contemplated having two steering committees. We thought we would have one that was a community group and that was representing community interests and that was diverse, and a second group that was going to be more our technical experts and primarily composed of capital project planners from other bureaus in the city. But we quickly decided that 2 steering committees was a lot of work, for one thing, but also that we wanted to demonstrate that we were valuing different kinds of experience equally, so that the input from residents and advocates in the community would be weighed alongside the expertise of engineers within the city, and that our plan process might be an opportunity for them to learn from each other. That doesn't mean everyone's super eager to be on our committee. We invited stakeholders directly to join, and this is where Danielle Butzik, who was our staff person on this, she did really a lot of work. She made a lot of phone calls. She took a lot of community members and representatives from not-for-profits out to coffee to talk to them about the value of the plan process to their organization and how we hope they would participate. And she particularly targeted groups that we knew were underserved, such as Coalition for Communities of Color, the Renters Advocacy Group, and the Immigrant and Refugee Coalition of Oregon. So asking them to be a part of the process. And part of our pitch was really that our intent was to empower the committee, that they were going to help steer the process, and that they would have the opportunity to promote projects and move forward things that they thought were of value. So if they gave us our time, and then we would honor their expertise. Having such a big and diverse group, it was important to have skilled facilitators. We had some really long meetings, and some at the beginning were contentious, and so that was something else that was important and that we contracted. Next slide, please. Because we had a committee that was diverse and came all with an expertise that was different, we needed to do some training for the group just at the very beginning so that we had a common background and understanding. We did an introduction to equity training. That's the picture that you see. That was just sort of basic concepts of equity and what the city means by that. I feel grateful to work for the city of Portland, which has equity as part of its strategic plan, and all city employees are expected to do training on equity. So we have that provided. And then Dr. Grover came and gave a more in-depth presentation about equity and natural hazard mitigation planning. For many of our members, they also needed a background on sort of the role of FEMA and the purpose of the natural hazard mitigation plan. So we provided that training, and following that, we did some groups. We did some discussion and workshop within the group to kind of work through those concepts. And I would also add something that came out of this for the Portland Bureau of Emergency Management that I thought was really great is that as part of this equity training, I and a couple staff people went to some more in-depth training on recognizing and undoing institutional racism, and we felt that was so impactful that our Bureau eventually sent every single staff member to a 3-day training about undoing institutional racism. Our director attended, our admin staff attended, finance, every person in our Bureau has gone through that training, and I feel like that we embarked on that. Natural hazard mitigation planning was one way that we started to be more explicit about how we were considering equity, but that is something that we realized needed to spread through our whole organization with training. So that was a great outcome for us. Next slide, please. So the other thing that was important to us is that we really be data-driven. We wanted to have input from community experts, but we also wanted to be to be accountable to the numbers. So we identified that you'll see across the top of the slide the areas that the community groups that we identified as being particularly vulnerable in Portland, and this was based mostly on literature review, but we looked at age, we looked at communities of color, people who are renters, people who are in poverty, and people who did not speak, who spoke English less than well. And then we looked at their exposure to different hazards. Liquefaction potential is, ground that's going to liquefy during an earthquake, so people who live there have a much higher risk of structural damage to their buildings during an earthquake. And so we developed this data and shared it with the committee and used it to inform our work in terms of how we suggested projects and prioritized projects. Next slide, please. And then in addition to having the steering committee, we also did direct community outreach. I think everyone does this as part of their natural hazard mitigation plan. It's one of the requirements to have the plan accepted by FEMA. I think in the past our Bureau had done, and I think we need to do kind of a general open house where they provide information about the plan and ask people what they think. We realized that that was not going to be super effective given our goals, and so our first thing was simply to articulate clear outreach goals to say what input are we seeking from this outreach, from this meeting or this open house event that that's going to be incorporated into our decision making going forward. And the second thing was to time those outreach events so they were weighted towards the beginning of the process. It's, of course, you need to circulate a draft of your plan and receive comment on it, but if that's your primary outreach method, we saw, well, at the point that we have a draft plan, we spent 80% of our budget, we put a year of work into it, it's not a good time to make big changes to the plan, and so we thought to sort of front load a lot of our community outreach processes. And we did it. We did geographic, like by neighborhood association, and also met with specific community groups, like I mentioned, the immigrant and refugee community of Oregon. So we did that outreach. We sought to connect it to a need that was particular to that neighborhood or geographic community or to the mission of the organization. So how does the hazard mitigation plan serve people who speak English less than well, or serve people who live in the floodplain in your neighborhood? And always when we talked about it, it was also important that we spoke about it as a partnership. We found that people were somewhat interested in the projects the city were doing and were willing to give us feedback on that. But it was also important that they were interested in what they could do to be prepared at home. And so we always try to present disaster resilience as a partnership. Here's what the city's doing to make Portlanders safer, and here's what you can do at home to improve the preparedness of your household. Next slide, please. Decision tools. So we also developed an equity lens that was like you'll see it in the late at the end, but like a one-piece of paper that was intended to be a series of structured questions that we used to evaluate every proposed project in our natural hazard mitigation plan. The idea is that we were going to approach things systematically and be explicit about who benefits from each project that was proposed, how they benefit, and whether there were unintended consequences of projects. And then the lens kind of prompts you to consider how you can modify the project to reduce the unintended or negative consequences or to spread the benefits more. And it looks at both procedural equity, so how the project's developed, distributive equity, so who benefits from it, and also structural equity, so how it contributes to having a more equitable Portland in the future. Next slide, please. So those are the steps that we took, and I'm going to talk just very briefly, because I have my eye on the clock, about our future efforts, our blue skies, hopefully before the flying cars. But next time we update this plan, some things that we would do differently based on our experience. Next slide, please. One, I think we would develop our plans in-house, although I wasn't unhappy with our consultant, and definitely they did a lot of heavy lifting in terms of the hazardous modeling and things. We found that they were experts in the FEMA rules around hazard mitigation planning, but equity was not their expertise, and we had a lot of revisions and a lot of back and forth. And even though I think they were interested in learning it and incorporating equity into their services that they could offer, it's also true that it was a national firm and it just didn't have local knowledge or local connections, so they couldn't help us meet community groups that we needed to know. That was something we need to build in house. And then also their plans, candidly, I think they write them from templates and they include a lot of language because it's relevant to some community somewhere. But the result is that we had a plan that was more than 600 pages long, which is pretty miserable. I'm pretty confident no community members wanted to read it at the end. We ended up writing our own executive summary that I'm hopeful got wider circulation, but as a planner, I want to see a plan that people can read at the end, and that was hard to get to. Next slide, please. We also we did a lot of training, as I said previously, with our committee, and took a lot of people out to coffee and talked to them about the work of our bureau and asked them to engage and to stay engaged. And what we realized is that was a big investment on our part and also on their part to learn about us and about hazards and the work that we do. And it doesn't make sense to make that investment in a committee that's only going to be around for a little while. But we would be better off to have a standing committee that could advise us on our natural hazard mitigation plan, but also other plans as we develop them, including our strategic plan for the Bureau and on our budget. And that has, for the resources that you put into it, that has much greater value for us, and that also it can have value for the participants, that it's a professional development opportunity for them, and that they really can be effective in gaining resources for their community if they put in the time, and they also advise on budget and other things. Next slide, please. We did a lot of work to develop data, but we also realized in that this didn't fit into the modeling software that our consultant often used, that a lot of it was still very qualitative, and that we should have is that we can over time develop better data that's more quantitative, and an equity tool that leaves not just sort of a description of the project, but a score or an evaluation that would enable us to compare the equitable benefits of projects to one another, or even across bureaus or across project types. Next slide, please. And then finally, I think our takeaway from this, which was really positive, is that we realized that natural hazard mitigation planning is super important to incorporate an equity component, but as our community members engaged in the process, they were really advocating for a lot of projects and measures that were things that our bureau definitely could undertake, but were clearly going to be outside the scope of sort of traditional natural hazard mitigation planning, or we're never going to get money from FEMA to do them, and that was okay. But that we needed to give ourselves permission to have a natural hazard mitigation plan that meets the minimum requirements set by FEMA, but really that's the plan that we own, and that also articulates a strategy of interventions that are things that we as an organization are committed to and want to move forward to regardless of the funding source. So overall, I would say it was a great experience for us, and I would be happy to answer questions. Yep, there's my contact information. You're welcome to call or email me. Thank you.
Thank you, Jonna. And I know you're literally stepping out in a minute or two to go present on this at the Oregon American Planning Association conference. So I appreciate your time. And please, anyone that's on this or watches this webinar later, Jonna's just been a valuable resource. She's been very open to talking with me about this presentation and providing tools and resources on their experience in the city of Portland, Oregon. So as we wrap up here, we've just got a couple other things here. I just want to show you that we've got some other examples we'll have hosted, but there was in Washington County, Oregon, they had a great social demographic. They did is more of the community profile, but it's a really nice, well done in terms of just highlighting not just what the statistics are, but what are the impacts, perhaps, if we don't help out these particular different populations. So we'll have this available. And then City of Seattle also did a great one in their strategy in looking with diverse organizations and agencies, an inclusive outreach and public engagement guide that we'll have available for those, a link to download these materials after our webinar. So with that, some of these next steps, of course, please talk to Himanshu and Jonna if you guys are interested in what they are offering. There's a lot of great information there. And but looking within your own community, tribe, discuss those opportunities. Get your committee together and think about discussing the opportunities for an equitable planning process, because everyone needs to have that buy-in initially of where you guys want to go. Reach out to state or local health departments, a variety of different community organizations or businesses that are connected to these at-risk populations. Identify some data sources, and I have some links here in just a minute. And I think maps are a nice way to perhaps start some of that visualization to see where our groups are at, and then to start talking how do we not just obviously reach out to them, but of course, how then do we help mitigate? So here's a variety of links, and I am missing a link directly to the City of Portland one, and I know you sent that to me, Jonna, so I will get that up there. But some left side, definitely some data resources you can get out there. So it'll be the Social Vulnerability Index of the United States, a very popular one that people download. You guys, of course, might have your own specific local data that you guys can use too, but we'll have these links. These are all clickable that will be made available. So today, I hope you've just learned what some of these opportunities are to address social equity through your mitigation planning process. You've understood some of the categories, or what are we talking about in terms of reaching out to the people and at-risk people, vulnerable populations. I hope you understand some of the challenges to ensuring an equitable planning process, and of course some tools that you can use to address. So I'm going to open up our last poll here. You guys can just help us out and let us know what you thought about this particular webinar, and we do appreciate feedback. We do read it. We have some upcoming trainings for you. Our last G318 of the year, that's our mitigation planning workshop that we offer in person, always in conjunction with our state or tribes. We'll have one here just next week. I think we just have one more slot left before our class is full, but we try to get at least one of these out to each state each year. But that's down here in Camp Murray, this is just south of Seattle, in conjunction with our Washington Emergency Management Division. Next month, we are going to be talking about integrating natural hazard mitigation plans into local comprehensive plans. Huge topic here. Another one that, again, I'm excited about because this isn't just about meeting requirements. This is going above and beyond to say, let's take it out of this non-regulatory plan and put it into something that has a little bit more teeth behind it. And we'll have some guest speakers speaking about their experience with it, either with a variety of different communities. So please join us. We'll have links that go on how you can register. You can always go to our coffee break site. We've had a variety of them this year. You can see what's next, and then our last one will be in December on mitigation and recovery planning and where that next is at. So with that, here's our contact information if you want to reach out to our state mitigation planners or myself and Amanda Syock with the FEMA Region 10 planning team. Thank you very much for joining us. Leave your feedback, and I'll turn it back to you, Becca.
Thanks, Brett. Thanks to our panel, Himanshu and Jana. Thanks also to our audience and those listening online. We hope to have you back soon in another edition of the Mitigation Planning Coffee Break series.